We're rolling. Okay, so my name is Dr. Sterling. I'm a physical therapist. I have a friend here that I've been working with. I'm gonna go ahead and introduce yourself.
My name is Alex Soto. Brazilian Jiu Jitsu Black Belt under Danny Alvarez. I like to lift weights and do Jiu Jitsu.
Awesome. Well, tell us about your knee injury. You know, I know you struggled with issues in both knees. Tell us about that, like how it all started, and just your whole journey with that.
Okay, so I originally tore my right meniscus a few years ago. I guess like 5 years ago now. Was lifting a lot of heavy weights, training a lot of jiu-jitsu. I'm not sure if there was any one thing that did it. It might have been a lot of things combined.
Sure. Yeah.
Because I was actually just taking the trash out whenever it popped on me for the first time.
I remember you said that. Yeah.
Yeah. So I had actually hit some weightlifting PRs. I think I deadlifted 390 or something.
Wow.
And I was feeling good, feeling strong, and then I'm just taking out the trash and pop. And
it's like the straw that broke the camel's back.
Basically, yeah. And back then I was training jiu-jitsu probably, I was 5 days a week, but some days I'd do multiple sessions.
So you're going pretty hard.
It's going hard, yeah. And yeah, so my leg locked up, and I didn't know how to unlock it. I kind of just left it locked because I didn't know that you could release it or anything.
Sure, yeah.
It was painful to walk for a while, and kind of started getting better on its own. And then while I was doing jiu-jitsu, moved a certain way, and it popped again. This time much worse, and it was locked up on me, and I actually had to be like carried to the truck, and it took a while before I could actually walk again. Went to go get an MRI, do all that. I ended up having surgery on it, meniscus repair surgery, and the surgeon recommended that because he said that removing it would leave bone on bone.
Right.
So basically, like me doing what I do, and at the time I think I was only 30, so it was like saying bone on bone would be like a big issue or whatever.
Yeah.
But it was pretty traumatic for me. It was super painful. Couldn't walk for like a few days.
What year was that surgery?
It was about 5 years ago. I don't remember exactly. I think it was either 2019 or 2020.
Okay.
Somewhere around there.
And then is this also when the left started to act up after that, or?
So I didn't have any issues with the left one until maybe like about a year ago. But so the right one, I had my quad atrophied. I did all the they said flex your leg and lift it and stuff to try to mitigate some of that.
After surgery, right?
Exactly, but it still happened. Like I just had like a bone. It was
yeah, sure.
I had a ton of atrophy, which led to like a bunch of issues after that.
And did you have formal physical therapy, or they just kind of gave you a set of things to focus on, like exercise?
Yeah, they didn't actually give me. I think they gave me like a card of like here's somebody we recommend, and they told me you can squeeze your quad and stuff. And
yeah, sure.
That's about it. Very minimal.
Okay.
So I kind of on my own I probably should have gone to see somebody, but I didn't.
Yeah,
somebody like you, right?
Yeah, definitely. It's all good. Hey, but there's some people that do that. There's some people who do it on their own, and they can do it, but sometimes you need just a little extra. So.
Gotcha.
Now, so you were trying to work on the right, and it just wasn't quite getting there. Was that also,
Yeah. So I went back to training jiu-jitsu probably a little quicker than I should have. Which
okay,
I think
sure.
is probably standard. Jiu-jitsu athletes just want to be on the mats.
Mm-hmm. Yeah, you love it.
Yeah, exactly. So I was back teaching pretty quick, and then I was back training, I think, maybe like a couple months after. But I had super terrible mobility, strength was bad, and I think I was doing like a lot of overcompensating. So I started having like hip pain. I would have like hamstring pain or calf pain.
Sure.
And then I, I think some of the modifications that I had to make to my jiu-jitsu like might have like led to alleviate, you know, twerking on this one. I think I started twerking this one more, if that makes any sense.
Yeah, like that's a type of compensation too.
Exactly. So I, you know, kind of with working with you and like as of lately, after having injured this one, I kind of have been able to pinpoint some of the stuff that bother it, like lateral movements. You know, if I like have to like twist my knee, like rotate my knee inward, you know, that my meniscuses don't like that very much, you know.
Sure.
But with the left one, I just healed it, just, you know, coming to you. I didn't get surgery or anything. I do think that it probably wasn't as bad of a tear, but I think like having gone through the surgery and how like detrimental it was to me, and like still kind of bothers me a little bit to this day. Some of the range of motion and some of the things, like I still feel like I'm having lingering effects. Versus like, you know, trying to heal it on my own. I'm sure every case is different, right? But trying to heal the left knee on my own has been great. I'm back to like training, you know, full clip without even really having to worry about it. There are like a couple of modifications that I made to the way I do jiu-jitsu.
Sure.
Which is just like, you know, not putting my legs in certain positions that I might feel that could cause, you know.
Yeah, that's smart, honestly, I think. And that's good to know for other people that do jiu-jitsu. You can still do it, you just gotta maybe be a little careful. Yeah, so tell me some of the things when we started working together. I think it's been like maybe 6 months ago we got connected, does that sound right?
Yeah, sounds right.
Yeah, so I met you at the jiu-jitsu gym and just kind of ran into you. And so, yeah, we started working together. Tell me some of the things that you thought were most helpful for your knee.
I for sure think that a lot of the like massaging that you do, because one thing that I would notice from, you know, training and like before and training after working with you is the range of motion and some of the like sticking points that I would have would be like less when you kind of work through some of the tissues and stuff. So I know when we first started working together, I was still kind of like weekly having it lock up on me. And I think whenever there was more stiffness, like in the areas around it, it was like more prone to lock up, like if I bent it too far or things like that. And over the course of time, I think, you know, loosening up the tendons and muscles around it made it like less frequent that I would have those lockups, and then so less swelling. And then also too the some of the stuff you did to like mitigate the swelling.
Oh
like
yeah,
that
I
helped
remember
a lot.
that. Yeah, sure.
And also too, you kind of like educated me on some things that I could do like on my own time. So some of the stretches and things, I would like do them at home, you know, and they helped. So
yeah, awesome.
I feel like that was a big deal.
Yeah, you know, it's a big deal that you do the education, because a lot of people just won't do it because they're lazy. So that's awesome you did that. But yeah, I want to kind of break that down. So like with your knee, kind of what I remember is around the joint line, there's all these like little tight spots. They call them adhesions, but basically sometimes it's just the connective tissue or the fascia. And then like today, we worked on your patella tendon. That was a little tight. And so yeah, just working on those spots and like getting them loose can help with your range of motion and pain, and then kind of allow you to do a little bit more. Yeah, I remember working like, you know, you get inflammation, but then we would kind of clear it up and then it would kind of come back. Now is it kind of, it seems to be improving? Is the inflammation kind of staying away now?
Yeah, so I haven't had a lockup in probably 2 or 3 months.
Awesome.
So with the lockups being gone, I don't really notice any swelling or anything. there might be like minor stuff that I just, it's not even on my radar, but
Sure.
like as far as swelling. But yeah, I haven't really had any issues with that anymore.
Yeah, and the lockup, it's a weird thing. So there's different theories on that, but they sometimes think like it locks when the bone on the bottom, the tibia, like connects with the femur, and just the cartilage is like worn down. They think some of that's like the locking up. And so what I like to do for that was the traction. Did you find that also helpful?
Oh yeah, for sure.
Awesome.
Yeah, and it also just feels good. I feel like there's not there's no way to replicate that.
It is tough.
Yeah. And so it's like, yeah, when you do those things, and yeah, I walk out to the car and I'm just like, I just feel good, like.
Yeah, I've had it done too, and it's a weird thing, but it almost feels like magic. It's weird, but I think it kind of opens up that space a little bit.
It makes sense. With like gravity, your whole life is just smashing your joints together,
Yeah.
and then you just pull them apart.
Do the opposite.
Yeah.
Something we never do. So awesome, man. Well, let's kind of dive into so now you're at like kind of the repaired and maintenance phase. So like there's still clearly work that needs to be done. You're not 100%, right? So kind of tell us like what is your max abilities in terms of like what you've been able to do physically, and then what things you're still working on to kind of keep it keep things at bay.
So I guess the biggest issue I'm still working through is my range of motion is not fully all there. But as far as like being able to train kind of worry free, that I'm like back at 100%. I can kind of give my full effort without having to worry about it. As far as like preventative stuff, I'm definitely way more proactive with my warming up.
Okay.
I don't want to go into anything with any kind of cold joints, I guess.
Yeah, that's really smart.
So.
And how has that changed your jiu-jitsu to when like that was always in the back of your mind, like is my knee gonna tweak?
Well, it's gotten better for sure. I kind of had a weird roller coaster of skill growth, I think, because having to work around that uses up like extra brain power, but you get like creative in other ways that you didn't think about before.
Okay,
so
interesting.
Then removing that and just being back to like not having to worry about it, I feel like now I can, like my processor is going at full capacity, but I still have that like creativity from when I had to think outside the box more.
Yeah.
So
like, how am I going to do this? Maybe something without stretching my knees too much. How am I going to submit this guy?
Exactly.
Yeah. So that's really interesting, fascinating.
And I don't want to get too jiu-jitsu technical, but there's a specific technique I used to do a lot. It's called a hook flip or a butterfly sweep, and it involved like loading somebody onto your shin, right? So that would put pressure on my knee. I had to like completely stop doing it for a little bit, and then I gradually was able to do it, but only in certain angles. And but it's like one of my best probably techniques that I use. So I ended up just getting more creative on the way that I do it, and I found like new ways to do it. And now that I can actually fully load people onto my leg, and I don't have to worry about them like crushing it or so the training wheels are off, but I still get to keep the experience of like having to work around the injury. So it's actually kind of in that way helped me get better, I think.
Yeah, like gives you more techniques. That's really cool. Very interesting. All right, man. Well, thank you again for sharing your story. Do you have any advice for anyone else out there that might have a similar injury, whether it's a meniscus injury? Is there any tips you have for them or anything like that?
Yeah, I would say you kind of, I think that everybody's probably different, and I think that you have to figure out what your, I guess what causes it, what flares it up and stuff like that. What specific movements do you need to try to avoid, you know?
Sure.
And I think working with somebody like you is helpful for that because you kind of know more about the physiology of like, you know, what different directions is the knee supposed to go, you know?
Yeah.
So like once I was able to kind of pinpoint like, oh, I should avoid lateral movements, or you know, I should avoid my wrestling shot and stuff like that, and just cut them out, and I was able to, you know, to heal without re-injuring, and then now I can start putting those back in, those type of movements back in.
Exactly. Yeah. Awesome, man. Well, very cool. I'm glad to see you doing well, and hope you keep doing well.
For sure. Thank you.
Yeah. Cool. Thanks, man.